Thank you. Thank you for joining Foremost Organization, known as the Consumer's Doc 1 or Consumer's Doctor. Today, I will talk about healthcare. We elect politicians, and they're supposed to be helping us Americans towards having healthcare access at an affordable price. This is not happening, folks. This is not happening. Why is that? Why is it we can't lower the costs? We have spent almost like $3.2 trillion. No other country has spent that much money. It has surpassed the national defense budget for the first time in history. You know where we rank on the healthcare? We rank 37th. 37th in the world in receiving care. What a shame. What a shame. These politicians are not doing anything. They're not helping us. And insurance companies have these politicians in their pocket. They pump money into the politicians and they don't do a damn thing to the consumer, you and me. And we are the one who's putting them in Washington. Why is that? We put them in Washington and they go with the insurance carriers. I just don't get it. I'll give you an example. Medicare is run by Department of HSS, Health and Human Services. They have the audacity to spend your money and put into the pockets of the health insurance companies. Yes, I'm 70-year-old. My $1,200 is going into the pockets of the health insurance companies. Give me that $1,200. I can get the best health care I can receive. And this is my body. They have no right to give Medicare funds to the insurance companies. Folks, this AARP, so-called American Association of Retirement, so-called ARP, is not helping us. They're basically going along with the status quo. They're not looking in the best interests of the senior folks, and we are the one who are contributing to the AARP. They need to make sure the senior folks are empowered. How do you do that? It's very simple, folks, very simple. Okay? First of all, if I'm on Medicare, I should be able to put money into the health savings accounts. I don't know, there's a stupid law. If you're over 65, you can't save money into the HSA. I don't know where it came from. You can't put money into the HSA. Whatever the little income I have, I should be able to contribute into the health savings accounts. You can't do that. You can do only up till 65. If you're 50 and over, yes. But once you get to the 65, you can't put money, shelter money into the health savings. That law needs to be changed. Second, I'm being bombarded with this ads day in and day out on the TV, in the media, bombarded with Medicare Advantage. It's a joke, folks. This is not a Medicare Advantage. Medicare Disadvantage. What they're doing is they want your money. They want your money, and stupid government is giving them the money. They're pumping the money into these insurance companies without our knowledge. Yes. I would like to receive my money back to me rather than giving it to the insurance company. Give me that $1,200. Let me make choices. I stay healthy. I jog. I take care of myself. I want to I'm the happiest I've ever been. I would like to I want to enrich myself in healthcare rather than these billing companies is a big joke, man. 20% of the cost goes to the billing companies. Do we really need billing companies? Really? We need to eradicate these completely ban them. After reading the book from Ron Bachman, you guys should read it. Unlocking the Secrets of Health Insurance Premium. That's the title of the book. Unlocking the Secrets of Health Insurance Premium. This gentleman has done an amazing job in writing a book. He has been an actuarial. He's the one who introduced Medicare Supplemental. We need to change the game, man. We need to change the game. We need to get our money back. In addition to my Social Security, give me my money on Medicare. I will take care of myself. I don't need the government telling me to go to this doctor, this place, and this. They don't need. I can take care of it. Give me that money. I will handle it. And I can lower my premiums with a high deductible. If I can afford 3,000, 5,000, whatever your affordability, 3,000, 5,000, 10,000, 25,000, I can lower my premiums, save the money, put money into the health savings. Even though you're on Medicare, you should be able to save money onto the Medicare health savings accounts. Yes. Once you have that, you have 100% cost. You can shop for the health care. You can go to the best doctor. You can go to the Mayo Clinic. You can go to Howard. As long as there is a price transparency in healthcare. We need to bring transparency back in healthcare. The time has come. Prices have to be transparent. You know what? We spent almost over 18% of the GDP on healthcare. You know what? How much the India spends on the healthcare? It is really shocking. India spends less than 1% of the GDP on healthcare. And they can probably do a better. I know they have a two-tier system, which I don't like it. Government control healthcare and the private people have to pay from their pocket. I would rather have access where consumers get to make a choice of their body. If they want, this is me. If I want to give the money in my health savings accounts, give it to my kids, grandkids, that's my choice. Government has no business going into my personal choices. And if I need a hip surgery, if I need a heart transplant, that's my choice. I will base the decision on price. Yes. This is me, folks. I want to see a healthcare Amazon. I want to see Google Amazon, Google MD Live, Microsoft MD Live, Alexa MD Live, Siri MD Live. You name it, folks. I have all those domains. And the healthcare Amazon, I would like to see consumers make choices, not these insurance companies. You know what? The technologies and consumer side, folks, I can ask a Google any question I want, I get the answers. I can ask any question to Siri, Alexa, I get the answers. Then I make choices. I don't need to be bombarded with these advertisements of Medicare Advantage. So-called Medicare Advantage is a disadvantage because they are taking your money. Your money. It is really, the time has come for the consumers to take care of the healthcare, folks. I would like to hear more comments, folks. I don't hear many comments. I would love to hear that. I would like to see consumers making choices on healthcare. They have been ignored for last 80 years. Consumers are nowhere to be found, and it's top-down. Government wants to control. They want a universal healthcare. It's a top-down approach, which is not going to work for the Americans. Americans will never go for the government-controlled healthcare. Look at what we have in Canada or England. I don't think Americans will tolerate class system. People have it and have not. And there is a way to provide the health care for people who can't afford it. I'm not suggesting this is only for rich people. This is for ordinary folks, man. They can get rich. And people who can't afford it, they economically impaired, physically impaired, we have a responsibility to take care of them. You know what percentage of the people who really need help? 1 to 2% of the population, folks. 1 to 2%. And these insurance companies have to do a risk segmentation. Right now, you're paying for 340 million Americans. Your insurance is based on 340 million. If you're healthy, your premium should be lower. If you are at risk, your premium should be 10% higher. If you have a chronic illness, you should be, the premiums have to be based among the, you know what percentage the people are chronically ill? 15%, folks. Their premiums have to be based within the chronic illness category. But insurance companies refuse to do that. Why is that? And why is it we are not asking insurance companies to segment it? And Health Review Authority, which is under the public-private partnership, should be able to monitor the health insurance companies, should be able to provide the best care for the citizens. Their job is to protect you guys, Americans. Health Review Authority should be able to do a better job under the public-private partnership rather than this Department of HHS is completely bureaucratic nightmare under the government umbrella. I don't like it. I want a public-private partnership where Health Review Authority monitors the people who can't take care of themselves. Those 1 to 2% of the folks, I can bet you, they will be better taken care of than ordinary folks. You know why? They get the best care, not this stupid Medicaid card, Medi-Cal card. They're useless. None of the doctors want to take care of the Medicaid. None of the doctors want to take care of the Medi-Cal. You know that. We all know that. But by having certificate of guaranteed coverage, I can vouch you those 1 to 2% of them who are economically impaired, physically impaired, they will get the best private care. They can go to the best doctor. They can go to the best hospital. Yes, that's what I would like to see. Consumers empowered, and we have a responsibility to take care of this 1 to 2% of the population who can't take care of themselves. That's our responsibility as Americans under the public-private partnership, folks. If you like this channel, if you do like to make some comments, I would love to hear from you. Subscribe, share, make some comments. I want to hear more comments from folks like you. Subscribe. Hit that bell button. Follow me. I'm Consumers Doctor, or known as Consumers Doc 1, under the umbrella of Foremost Organization. Goodbye. God bless.